Good evening and welcome to Beaufort County News and Views. I'm Catherine Glover and I'm the director of the Washington Beaufort County Chamber of Commerce. Speaking tonight with Dr. David Dirks, and he is with Dirks Chiropractic. Welcome.
Thank you for having me today, Catherine.
Glad to have you. Let's talk a little bit about your history and how long you have been in Washington. I also know that you've opened some new branches and some stuff like that. So talk to me a little bit about how long you've been doing what you're doing.
Sure. We first came to Washington in 1996, way back before all the hurricanes started, and we were there for about 11 years at the old bus station. We moved back to our home state in Minnesota for a little while, forgot how cold it was, and then we decided to move back here about 2 years ago. And now we have an office in Washington right across from the Hampton Inn, and we also have an office in Winterville. So kind of able to serve both Beaufort County, Hyde County, and then Pitt County as well.
How long have you been a chiropractor?
I graduated in '93, so I guess it's been 21 years. And it's been great. We learned things along the way. We're able to help thousands of patients here in North Carolina and in Minnesota. It's really fun.
So talk to me a little bit about why you decided to become one.
That's good. That's good. I was 17 years old, Minnesota boy playing hockey. I went into the boards really hard and dislocated my shoulder. Thought I was captain of the hockey team. And one of three, but dislocated my shoulder, didn't think I was going to be able to play anymore. Mm-hmm. And I went to an orthopedic surgeon. They told me surgery was probably my best bet. Of course, just like Washington, Go Pampec, they're going to the state finals or the championship game.
Mm-hmm.
We were going into our finals in Minnesota, and I wanted to play. So I went to actually my mother's chiropractor at the time, and he examined me and found out that not only had I dislocated my shoulder and injured that, but I also had a whiplash type of injury. When I hit the hockey boards, my neck went back and forth. And so he proceeded to do some adjustments or chiropractic type of treatment on my neck and my shoulder. And within a short time, I'm back on the ice. We played, we lost, end of story. But that's how I was helped greatly by a chiropractor back when I was 17. And I just thought it'd be a great career path for me.
Very neat. And so what is the basis behind the practice?
Well, chiropractic is based on maintenance or the health of the spine. If I show you on this, there's 24 vertebrae or segments of the spine, starting from the base of the skull all the way down to the tailbone. In between each one of these little bones are the nerves, spinal nerves. Those nerves go everywhere. Eyes, ears, nose, throat, all the organs, heart, lungs. If you have anything in the body has a nerve attached to it, those all come from the brain down through the spinal cord and then branch out. What chiropractors look for, examine, and treat basically are called the subluxation of the spine. When a bone becomes misaligned, out of position, or doesn't move well, oftentimes it will cause pressure or irritation to the nerves of the spinal nerves. And wherever that nerve goes, whether it's down your arm, down your leg, your heart, lung, liver, whatever the case may be, interferes with the function. So a chiropractor's main job is to detect these changes in alignment and motion of the spine, called subluxation, and treat those, correct those with what are called adjustments. Certainly different than the medical model, but oftentimes, we certainly work hand in hand with the medical community. If it's something that chiropractors can't treat or aren't responding, we send them to orthopedic doctors, neurosurgeons. So there's community involvement as far as the medical community in chiropractic.
And then, do people normally come to you for, I guess, a maintenance situation or after maybe an accident has happened or something like that?
Yeah, that's a great question. Both, really. We often first meet people from an acute injury. Say you slip and fall, you lift your child and you get that kink in your back, or you wake up with the sudden kink in the neck. Those are common reasons why people come, and certainly auto accidents. If you drive in Greenville, which most of us do, unfortunately, the very high incidence of having some type of wreck, sooner or later, and trauma to the spine is during car accidents or even slip and falls are one of the major problems with arthritic change down the road. So, very paramount that you get checked after a wreck, whether it be by your medical doctor and or chiropractor, to see if there's any injury. But from a maintenance standpoint, oftentimes as people get older, let's say about 40 years or so, that seems to be the magic number for the spine. Just like a car that has so many miles on it, you're going to need to have a little more maintenance, a little more oil change, a little more rotate the tires, change the brakes. With your spine, oftentimes maintenance care is needed as you get older. Not so much when you're in your teens or 20s, but 40s, 50s, and 60s, we're finding that regular type of care maintains the health of the spine better than if you just come in when you're hurting, so to speak.
So there's both that you can do, obviously, after maybe an accident or something like that has happened, but also the maintenance piece. So we're going to take a quick break, and we'll come back and learn a little bit more about that.